Hi guys, Dr. Jeremy Height here with Pinnacle Chiropractic and Rehab in West Fargo with this week's Did You Know? What I wanted to go over this week is proper lifting. We often assess patients that come in our office with back pains, disc herniation, sciatica, and I have them show me how they're bending, how they're lifting, and they have abnormal muscle patterns that can cause these issues in the first place. And many times what happens is I ask them to pick something up and they bend all with their back. It's a lot of back activation, putting a lot of stress on the disc, on those tissues, on that sciatic nerve. So incorrect lifting technique is really using a lot of our spine. So our kind of lower back just going forward. And when we're bending forward like that, especially when we're picking something up, we call it flexion under load. That is a very negative thing for the lower back. So what we want to use is something called the hip hinge. When we're bending, we want to keep our lower back and our spine very stiff, very sturdy. We don't want a lot of range of motion coming from there. We want it coming from our hips. We want it coming from our knees. We want it coming from our shoulders. Power lifters, some of the strongest people on this planet, they can lift 800, 900, 1,000 pounds without getting injured because they use this technique. So what we want a nice stiff spine. When we're bending forward, we don't want motion in that spine. We want it coming from the hips, the knees, and the shoulders. So we're gonna go down, we're gonna keep that spine straight, and then we're gonna lift, and it's all coming from those legs and the shoulders and the spine. So if we have an issue with this and patients aren't able to get down as far, I would try to get a little bit wider stance, or we can go with like a split-legged stance where one leg is forward, keeping that spine straight and then coming down, a lot of hip motion. A lot of times what we actually see is that patients have been lifting incorrectly for so long that we need to retrain these muscles. So there are some exercises that we can do to really help kind of get those hips, get those glutes firing. Because if patients are able to lift like this, go to work and lift correctly, we're going to significantly lower any chance of injury. All right, I'll see you next week on another episode of Did You Know?